We're honored today, everybody, to have for our Real Talk, David Goldberg, CEO of Mon Health Systems, and Ashok Aggarwal, Intermed Labs. We're going to have the opportunity to listen to their experiences and how they're meeting the needs of West Virginia community, looking to the future, and with innovative technology and the advancements in healthcare. So I'm going to introduce David first. He's the president and CEO of Mon Health Systems since 2018. Prior to Mon Health, he had served 17 years of senior healthcare leadership, serving as senior vice president at Highmarks Health Allegheny Health Network in Pittsburgh. While he was there, he was responsible for administrative services and had oversight for corporate services, including post-acute services, external relations, provider systems operations, and implementation of the network's neighborhood hospital development with partner Emirus. During his time at AHN, he also oversaw 8 acute care hospitals, multiple ambulatory surgery centers, urgent care centers, several full-service ambulatory pavilions, and network joint ventures throughout AHN's Pennsylvania service area from Erie to Pittsburgh. His extensive healthcare administrative background includes serving as president of 2 hospitals and service line executive for cardiovascular and behavioral health services at Tenet Health's Baptist Health System in San Antonio, Texas, and also vice president and administrator with Innova Health Systems in Falls Church, Virginia. He holds a master's in health systems management from George Mason University and a bachelor's degree in political science from WVU. David, is there anything else I missed, or you want to give us a little bit more background?
Well, it's great to hear what I did in my past. I'm excited what I'm going to do in the future, but the most important is I married my college sweetheart here from WVU, and I have 2 gorgeous, intelligent daughters. One who's a junior at Ohio University, and my youngest daughter is entering her senior year of high school, and couldn't be more proud.
Awesome. Do you want to, since I covered the background of you, the backdrop, do you want to go ahead and let us know what led you to Mon Health System before I move on to Ashok?
Yeah, as you see my ring, I'm a WVU graduate. I mean, the opportunity to come back to West Virginia was awesome. I got a call in the spring of 18 from my godfather, who introduced WVU to me many years ago, how I got here in the 90s, that there was a management change at Mon Health Medical Center, Mon Health System. Would I be interested in the opportunity? And I went, I already have a job, as you heard it, in Pittsburgh. Bought my season tickets, liked the hour and 10, 15-minute drive down 79. And then I started doing some research on Mon and saw how far it grew from Mon General to Mon Health Medical Center to Mon Health System, 2 other hospitals. And I was really intrigued and still continue to see we lead in clinical outcomes, progressive care, patient experience, quality. And I was intrigued. So I said, you know what, I'll talk with them. And here I am, then was offered the job to come back to my adopted second home. And here I am today and couldn't love it any more than I do, and continue to be bullish about the future through Mon.
Wonderful. I love it. Sounds terrific. And I know your family is really important to you. And I love that you added that in there, because they make all the difference with these when you're in a high powered job like you're in.
It's not going to say on my tombstone that I was the CEO of X or COO of Y, but it's going to say, hopefully, beloved husband and father. And that's my why is for my family.
Fantastic. Let me move on to Ashok. He is the co-founder and managing partner at M&S Consulting since 2002, a leader in technology and process project delivery. He makes good things happen. He holds a BS in biomedical engineering and a minor in computer science from Johns Hopkins University. As the co-founder and chief strategy officer of Intermed Labs, Mr. Aggarwal helps with startup idea evaluations, startup spinouts, and strategic hospital partnerships. Ashok, is there anything you want to add to that?
Well, I mean, I like my family too. So, I think after David's introduction, I do have a wife and 3 kids. And I'm actually a native of Morgantown in West Virginia. I was born and raised in Morgantown, and, left the area for school and started my career out in the DC area, Northern Virginia, and then down to Charlotte, North Carolina. And then ended up back in West Virginia due to a family health issue. So family is actually the thing that brought me back to the area, and thought it was going to be temporary, but you know, with a wife and kids that were starting to get incorporated into the community and kids in school and whatnot, we ended up just deciding to stay, and now it'll take a crowbar to get us out of here. Really excited with the work that we're doing here with Intermed Labs and partnership that we have with Mon Health and other hospitals, and startup ideas that we're looking to get involved with as well. So.
Wonderful. Great. Both great work lives and home lives. I love that. I'm going to jump right into some questions since we're running a little behind. David, I'm going to start with you. And Mon Health Systems is well regarded for all the medical services provided, from inpatient care, which are grade A in patient safety, outpatient care, and new ways to deliver assistance to patients throughout real-time 24/7 emergency assistance, telemedicine, and new technologies that improve the well-being and health for the communities it serves in Morgantown, Kingwood, Weston, and Grafton, West Virginia. Can you share with us a little bit behind the scenes of your day-to-day and how your team works together to advance initiatives at MHS?
So day to day, it changes. Anyone in business probably has the same issue, but you know, I come in with a set schedule, and a regulator could show up and change everything. You could have a disgruntled patient. You could have a pandemic. You can have a fire. So anything with businesses, you got to be nimble. I'm blessed with an outstanding leadership team that is always focused on quality and service first. And I could say that across all of our hospitals. We're also in the process of integrating what is Mon Health today. You heard all the different sites. What I inherited was really a holding company model where you had two other hospitals along with what is, everyone loves Mon General, but Mon Health Medical Center. Every hospital employs their own doctors. That's the certificate in need law for community hospitals like ours. And what I came into was an organization that made very strategic investments, acquiring real estate, building buildings, acquiring physician practices, affiliating with physician practices, but they were left to be held. They all had their own electronic medical record. We weren't coordinating our IT systems from finance. We had different health plans. We had different pension plans. We had different retirement plans. So, and it was reported that the organization had a $26 million loss before I got here. That wasn't exactly accurate. It was a planned investment in everything I just mentioned. And over the years, we've been great stewards of our dollars. So we were able to take our treasury and be more specifically and strategic in where we want to grow. And that growth is community focused. Then we implemented our strategic plan, and that strategic plan over a 3-year period really encompasses, and here it is right here, I keep it right next to my desk, not that you can read it, but it starts with quality and safety, people and culture, integration and efficiency, stewardship, not cost, but stewardship, strategic growth, meaning grow strategically. Everyone here knows you can grow into bankruptcy very quickly, and in healthcare you have different payer sources, Medicare, Medicaid, PEIA, Blue Cross Blue Shield commercial. And you got to be strategic in where we grow and how we grow it and invest our dollars and hire people. And then we added another, which is called the physician-led care team, where we want to engage our doctors to clinically lead what programs, what location, what methodology. Ashok will talk about Intermed Lab, but they devise things to improve the patient experience and the patient outcome. And how do we make this the haven to advance? And over 3 years, we've turned ourselves around more than $100 million. We've had our bond ratings reaffirmed by the rating agencies. We've grown our assets. We've grown geographically. We're now in Hopwood, Pennsylvania. We're in Garrett County. We're as far south as Elkins. We have nearly 60 sites. You mentioned Grafton. We signed a clinical affiliation with Mini Hamilton Health System in Gilmer County. And that's not because we're trying to grow for growth's sake, but it's always led, what does the patient need? How can we assist? Do you want us? because you can grow into markets and be aggressive and aggressors. And I don't think in all cases that's appropriate. But if we have the bench to bring care close to home, that's the model that we've embarked on. Maybe my days at Highmark Health learning about insurance and payment. But to me, it's about bringing care close to home. The hospitals have been the center of the ecosystem of healthcare for way too long. The economic model today is you drive a patient to a hospital, that's where you get the best revenue. But is it best for the patient? Is it best for the family? Can they be treated in the medical home? Can we do same-day orthopedic joint replacements in a surgery center, which we own, one with our independent doctors? It's 2/3 less expensive there, better patient experience and outcome, but it's less reimbursement there than what we would do and get if they were a hospital patient. So we look at that and say, what's best for the patient? So we partnered with independent orthopedists and Dr. McClellan, who's a plastic surgeon. And what they've done is they've driven that business to do hundreds of cases a month, reduce the cost, improve the outcome, as one example of being what's called value-based in how we approach care. It's not about maximizing the revenue, even though every dollar matters, but what's best for the patient in the triple aim of best service, best quality, lowest cost.
And that was one of my questions as well, in building stronger communities. You just covered it by what you just said.
Most of your hospitals are, in many cases, the largest employer and beacon of a community. You know, right outside my back window, I could see WVU Medicine, and we have a very collegial relationship. We compete, but we're very blessed in North Central West Virginia. But then you go to Grafton, only hospital in Grafton, Taylor County. Then you go to Kingwood, only hospital in Preston County is Preston Memorial. You go to Lewis County, only hospital in Lewis County. So we've got to be good stewards of those dollars and do the right thing at the right place, but also make sure we can afford it and make sure we bring care close to home as affordably, highest quality as possible.
So that kind of ties into what are some of the key things you're doing to improve health security in West Virginia, that low cost in those communities. And is there anything else you want to mention about health security?
You know, I led off with my why. You know, it was always Mon General. Well, do you know, I do this a lot. It's called the Do You Know tour. But Mon Health is the 9th largest employer in the state. We went from $835 million in gross revenues to this year, 1.1 billion. We have $200 million in payroll and employ 3,500 people. And we're in many joint ventures. The Holiday Inn in Morgantown, we own 30% of. We're part owners of Health South and Compass here in Morgantown. We are joint ventured in a hospice company, a durable medical equipment business, rehabilitation business, and plenty others. So we've diversified our base, but it's all about the ecosystem of the patient. And it isn't to maximize that Mon get those patients totally, but to bring the services that the community needs at the right place in the right way with really good, solid content leader partners to lead those businesses to maximize the revenue, but maximize the experience, the quality outcomes. And we're really good hospital operators. You know, Mon Health Medical Center and Stonewall Jackson Memorial Hospital are the only Leapfrog A hospitals in the state. There are no Bs, and then there's a lot of Cs. Stonewall Jackson Memorial Hospital is a top 100 safety net hospital. Preston Memorial Hospital has a center of excellence in bariatrics. We are the only American College of Cardiology heart care center in the state of West Virginia, in the region, not even in Pittsburgh. We're number 24 or 25 here at Mon Health Medical Center. We're the only AFib accredited hospital in the state, let alone in the region. Why do we do it? Core competency of our market. We're a Medicare community, a lot of people with heart disease and heart ailments, and we're maximizing on our strengths and then bringing that to bear with minimally invasive surgery. We just invested in a technology as I transitioned to Ashok and technology. We bought a device called the Monarch. Many of us have heard of lung cancer. Here in the state of West Virginia with coal miners and others, a lot of lung disease, pulmonary disease, COPD, lung cancer. Well, we invested in a device paid for by our foundation, so from donors, for a thing called the Monarch, which brings a tube down your throat instead of invasively, find the nodule, take the nodule out, minimally invasively, to be able to find out if it's cancerous or not. We're the only one right now in North Central West Virginia that's offering that device through Mon Health Medical Center. So it's those kinds of things that our doctors bring to us. The Watchman, which is a new device in AFib, irregular heartbeat. We're on the third iteration of the clinical study with Boston Scientific here through Mon as one of the leading Watchman implantable hospitals in the country and in the region. So we lead clinically and then make sure that we marry it to good economic performance, but also keeping the patient in the center of what we do.
Fantastic. That ties into my next question with working with partners in the med tech space on improving quality of life outcomes from illness, surgery. I think you just touched on all that. So I'm going to go ahead and switch to COVID. What can you share with us? It's been a challenging year for everybody, really longer than a year.
Yeah, and we're not out of it yet. While we're all socially distant, I'll make my plea, please mask as appropriately, socially distance yourself. And I am vaccinated. My badge, I wear it everywhere. I don't have 3 eyes. I don't have 3 arms. I'm not microchipped, so my wife has no idea where I am at any time given day. COVID was an interesting experience. Hospitals and healthcare always prepare for the unexpected. We do shooter drills. We know about flu season. We're used to infectious disease issues. This was, as all of us have felt, a very odd experience to go through, a pandemic like we've not seen in over 100 years. Mon Health, we stood ourselves up starting in December, almost a year ago. We started buying up extra supplies because we saw what we thought would have been a very more heightened flu season and infectious disease period. So we started staffing up, and then March came. I'll never forget it, when we closed down procedural areas, people were pretty much asked to stay at home. We never laid off a staff member. We flexed to volumes. We moved people into positions to do rapid testing and screening. And we lived through it. As a health system, we had almost a $50 million impact from COVID alone in lost revenue and higher expense. But that being said, the federal government stepped up and we received some COVID support dollars and advanced Medicare payments, which we have to pay back over time, grants. That is negated all but about $7 to $10 million here at the health system, with people starting to come back. While that all happened, our bonds were reaffirmed. We turned our bottom line net assets by $77 million over a year, continued to give raises to our staff, matched their 401k or 403b matches, hired, built new buildings like the neighborhood hospital that'll be open by December, a new medical office building in Fairmont, helped graft and stabilize. They pretty much would never have survived on their own, and continue to grow. And we launched Intermed while that all happened during a pandemic. So we at one point, we never were overly full. At one point, out of all of our 4 hospitals, we had about 40 COVID patients, which is a lot for us because we're about 550 beds licensed across our 4 hospitals. So nearly 10% of our beds were COVID, but we always had throughput, and we continue to monitor it on a weekly basis. My family's still in North Pittsburgh. I didn't see him for 12 weeks when I was here, helping manage through it. The eeriest feeling, I live in a condo above the Marriott, and looking out and seeing no cars go across the Westover Bridge and down University Avenue. And my apartment has an echo of car sounds off the river, and to hear none of that for weeks. But I couldn't be more pleased. We never had an issue of staffing shortage. We had people with COVID, but we managed through it. We have a daycare center, no transmission in the daycare center. We have the Village at Heritage Point, over 55 community with independent living and senior living. And while we have people impacted, knock on wood, no one died, and we were able to contain it. So I couldn't be more proud of my staff and the people that were on the front lines to take care of their community, putting themselves at risk to take care of our own. And we were stronger for it. And I can't thank our federal delegation, the leadership of the governor, General Hoyer, Dr. Marsh, Clay, for all the great work that they did to get us through it. And we came together as an association of hospitals that compete for the betterment of the community.
I see a question pop up. Do you want me to read it to you? Or do you want to wait till the end, David? Go ahead.
Yeah, I
read it.
see it's from Sarah, I think. Can you share a little more about your vision of community-based healthcare evolve given this current cycle of technology innovation? Yeah. Healthcare is still personal. It's about the patient, and we need to create the right environment where technology could help us. Artificial intelligence is something you're hearing a lot more, the blockchain, and that's all important. But what we don't want to do in healthcare is become Big Brother, where that information technology or artificial intelligence leads too much away from what the doctor has to do to diagnose. I think a standardized electronic medical record where your information's in one place, where you could harness that information to be able to know what your trends are, is an important aspect. To reduce over testing, when you already see the patient came in for an MRI this day, do you need to repeat that MRI because it's already in the medical record and the doctors can review that? Those are some examples. I know Ashok will talk a little bit about Intermed, but it's about creating the environment where our doctors who treat our patients, who find novel ways to create a device or create a pathway or an approach to reduce pain, improve outcomes, and through Intermed, find a way to improve at the bedside or the bench side, are some things we're working on. Technology is moving at a fast pace. How many of us remember when your wives or cousins or sisters delivered a baby and you were in the hospital for 3 to 5 days? Now you're in for maybe 2. I mentioned same-day joint replacement. In the past, it was maybe 2 weeks. Then it got to 3 to 5 days. Now we could do it in a day and you're out in a surgery center. Chemotherapy doesn't have to go to Hopkins. It doesn't have to go to Allegheny General. It doesn't have to go to the Hillman. It could be in the communities like we do at Stonewall Jackson Memorial Hospital. And we're about to offer and start offering chemotherapy in Preston Memorial so the people of Preston County don't have to drive in. That all is technological advance around medicines, about equipment and protocols and pathways.
Well, that was wonderful. Wow. I'm going to let that transition over to Ashok and say a little bit about the Intermed Labs serves as the innovation arm of Mon Health System. It's an award-winning innovation lab and startup studio that advances technological breakthroughs in health technology, working with talented physicians, companies, and healthcare systems to conceive, launch, and scale new businesses. Ashok, do you want to share a little bit more about what you're all doing and give us some insight on these new medical devices and the startups that you're working with?
Sure. Yeah. No, happy to.
Welcome.
And yeah, really excited about what we're doing here at Intermed Labs. It's a very unique model, one that we haven't actually seen built anywhere in the world. We are essentially working with hospital systems. Mon Health is one of them, and our initial flagship one, where we are basically going out very upstream in the process of an idea and helping it to become a reality. So if you look at today, 99% of ideas that are in medical staff brains pretty much stay in their brains. There's story after story about surgeons in an OR that'll say, wow, that was really hard. If only I had this one thing, that would have made that go a lot better. And the conversation ends, they go their separate ways, and everything's over. The reality is that there's a lot of accelerators and incubators and those kinds of organizations that cater to startups. So those are those physicians and other people that have identified an idea, had the motivation, time, and willingness to go and set up a business and start to spend some money on prototyping and proving out their idea, and then getting to the point where they can present and possibly become an organization that can spin out and become a part of an accelerator or incubator. The reality is that we are filling that gap where there's an idea and helping these kinds of people prototype, prove out a concept, build out a medical device, put it on the benchtop and test it, do some market research, and help them turn it into a business. And that's essentially what Intermed Labs is setting out to do, is take ideas and turn them into a business. So we call ourselves a startup studio as a result. So we work on our own ideas, and we have a number of those, which I can get into at some point. But we also work with physicians and other medical staff to bring their ideas to reality. A lot of times, surgeons will have an idea, and well, one, they won't know what to do with it. They won't know what steps to take. You have places on the coasts that have detailed infrastructure, primarily because they have built that infrastructure around technology initiatives. And so there are people that folks on the coast can go to and start to talk to. But when you look across middle America, there's a lot of people that have incredible talent. And that's really part of our thesis, is that middle America and places like West Virginia have incredible medical talent. They're trained at the same places as physicians that are living on the coast, but they don't have that infrastructure and pathway to take their ideas and turn them into businesses. And that's the gap that we really fill at Intermed Labs.
Do you want to share some of the cutting edge technology on the medical devices that are life-changing for folks with injuries and disabilities? And also, I'm going to ask if you can share a little bit about the Olympics. Tom had mentioned to us that you all did a little bit behind the scenes with some of the athletes for the Olympics. Love to hear that as well.
Sure. Yeah, so we work with a number of different ideas. Some of them I can't talk about, but some of them I will. One of the ones that we launched not that long ago is Fingy 3D. And it's a combination of hardware and software. And it's really to address people that are missing a digit on their hands. And there's actually a lot of these people. Oftentimes they're younger people and older people. I was talking to some orthopedic surgeons, and they mentioned there's been a big uptick on people that have lost a finger because so many people have been doing home renovations during the COVID pandemic and on their own at home. And in any case, right now, if you look at folks that have lost a digit, and I would imagine if I were to ask everyone here on the call, if they know somebody that's missing a finger, or at least part of a finger, most people will say, yeah, I know somebody. Ellie, do you know somebody, by the way?
I do.
Yeah. Most people know somebody that's missing a finger, and most of those people are actually, continuing on their lives just with a missing finger. Getting a prosthetic is a process, and it's somewhat expensive. So Fingy 3D basically just allows a person that's missing a finger to go through the Fingy 3D app and take a picture of their finger, and we'll build a custom prosthetic for around $50, and they'll have it at their house. So that's one of the ideas that's
Awesome.
that's out there. And actually, as a result of that idea, we submitted that to an international competition for innovation on behalf of Mon Health. And it's the organization is ECRI, and somewhat magically, we won that award, gotten first place for it. So I think that's
awesome.
really elevated. Elevated our community, elevated what we're doing at Intermed Labs and Mon Health. And I think past winners have been UPenn and organizations out in Boston and really around the world. I think in Texas, Vancouver, and other places. So that particular idea has gotten some steam, and really when you look at it, we're doing this out of Appalachia. We're really able to prototype these ideas more cheaply than other places and other people, especially on the coasts. Yet we have incredible talent right here that's actually accomplishing this work. So another idea is one that has stemmed from a physician at Mon Health, and works with David closely and has been a supporter of Intermed Labs, Dr. Rat Shukuri. So he is working on a device that will help surgeons that are working with fecal incontinence. It's a complicated process that requires surgeons to go in and through the behind of a patient, and the process of hitting the right spot and the right nerve when they're implanting this device can be pretty complicated, and in some cases can cause a lot of pain for patients. So we're working with him to build a device and really solve that problem. So in that case, he came to us with a problem. He came to us with some ideas on how to address it, and what we came back with was a solution that was fairly advanced that would actually accomplish the goal and get the work done.
How long does it take when you have these ideas? What's the I'm sure it's costly, number one, even though you said it's less costly at Mon Health. What's the time frame to get something to market? And how do people find out if you're working on something? How would they find out if they want to be part of the trial or,
Yeah,
anything?
so for the ideas that we're willing to share, they're online at intermedlabs.com. And so, anyone's welcome to look at those ideas out there. Each idea is somewhat different. For the ones that I mentioned, I mean, Fingy was a very fast process. Within 2 months, we had the prototypes built, went through probably 5 different iterations and built out the technology platform as well as the ordering process. So very, very, very fast. We partner from a technology perspective with M&S Consulting, and so that group really helps move these things along from a technology perspective very quickly. When we look at Radian, which is the idea I was just referring to for fecal incontinence, that one is going more slowly, I would say, just because there's a lot of iterating that needs to happen, and our team is going into appointments with the physicians and working with them to really understand that particular problem and use case better and better. Had our first piece that we started to take in and we started iterating within a month or two on that particular idea. We've got an idea, and probably the most exciting idea that we have is the Viking needle. That's one that came from a physician out in Salt Lake City, Utah. Not a physician, actually, he's an engineer. And he had this idea to improve the needle that's going into rotator cuff surgery. And so for sutures that are happening, that can be very difficult when going through rotator cuffs. And he's been working on that. It's got a couple patents, and he's been working on that for multiple years, right? We've gotten involved to help improve that idea and help take it to market and turn it into a viable startup. And that's been,
Yeah, Ashok, if I could jump in on that, I think the important part is we're the front of the ecosystem. We're where the idea gets presented and kicked around and tested. And then as it moves its way through with our connection, like with Mike Green and Matt Harbaugh, with Mountain State Capital and others, as it comes through, then we have a pipeline of potential larger dollar investment that we can bring through, but we're not going to run the company. I mean, we might, but that's where maybe Advantage Ventures or others help link up how to take it from concept, hopefully to be bought idea, maybe into a company in there. So I think there's the ecosystem is here across the way. Ashok mentioned about the ECRI. I had no idea how powerful that was. We were spotlighted in Times Square. They bought Times Square, and those big jumbotrons that you see had ECRI, First Appalachia organization, and Mon Health is in Times Square. I joke with my daughter, who wants to be a theater director one day. I made it to Times Square before she did. So, I mean, it's unbelievable what it is, but it's about an agnostic approach. We're open to anybody. You have a doctor that you just heard from Mr. Aggarwal talk about the suture needle, isn't from our community, but through connections, brought it to us because of this proven technique. Dr. Shakuri Rad's on the staff, there's engineers. The exciting part is I don't get involved. These are the entrepreneurs. I just came up with the money and gave them the space, and then they're doing it. The second is we have students that are creating this as going through their baccalaureate process at WVU that are WVU engineering students that are working hand in glove with the team to do this. That's the exciting part, that we're so lucky in West Virginia to have the Marshalls, the WVUs, the Fairmont States, I can go on and on, the Glenvilles, you name it, where we have this talent, where you have doctors, you have budding engineers, great IT expertise, infrastructure, businessmen and women. And here we are able to do this to move West Virginia forward.
I love it. It's so great for our state. And Noah posted, thanks Noah, he posted the link in the chat that everybody can read if they want to hear about the award, your award, your achievement.
Very involved in that Fingy 3D project. He's done a great job.
Last question for you, Ashok. What challenges do you think you've overcome with Intermed Labs with your team to continue to break through on these medical devices and applications? Anything?
Yeah, there's probably many challenges. I'll pick out two of them. One is that we're providing, a world-class service out of Appalachia. I look at these ideas that we have. One's from Salt Lake City, one's from Florida, a couple right here in West Virginia, and of course, Dr. Tom McClellan and Justin Chambers, my co-founders, have already taken many devices out and put them on the market, and had a few of them acquired. Doing that out of Appalachia and out of West Virginia, I think, is overcoming a challenge. That's not an area that people have expected this kind of innovation to come from. So getting known out there, I think, has been a challenge we've been able to overcome. By the way, we're also part of the Global Startup Studio Network, GSSN. There's, I think, 26 studios that have been selected from around the world, and we're one of them. We're the only ones in probably a 200-mile radius. And so just overcoming that, probably some of that stigma, and helping people understand that this is world-class service and world-class, results that they're getting right out here out of West Virginia with Intermed Labs and Mon Health. And I think, secondly, just getting people to understand that they can bring their ideas to the table, even if they get shot down. You'd be surprised, Ellie. We are inundated with ideas from medical staff. There's too many that we can't even handle them all. So we have to. That's a good problem to have. That's idea flow, much like deal flow for VCs. It's a good problem to have, but I think we've been able to overcome that. People in the area, I think, are clamoring for this kind of service, this kind of a capability. So getting that word out there is just going to make better products and better innovation that will ultimately help the human condition, which is really our goal.
Wonderful. I agree 100%. One last question for both of you before we go to a few questions. If you were each sitting in a seat where you are right now, 3 years from now, which we hope you guys are, what are some of the key outcomes you would like to see Mon Health System and Intermed Labs have on West Virginia that give us a lasting impact for years to come? Is there anything that stands out to both of you that you'd like to see?
Start with it.
Yeah, I'll say first, I want to see one of our ideas, not 20, not two, but maybe one, actually improve a patient outcome because doctors had a venue, or nurses, or phlebotomists, or an environmental service worker, or an engineer in the community came and brought something that improved the patient outcome, reduced the healthcare cost, and maybe we were able to commercialize to bring investment back in to expand the ability to provide care close to home. The other is to stay fresh in the mind. When Dr. McClellan called me on a Saturday morning and said, I have a crazy idea for you. And we talked for about an hour and a half on a Saturday, and it was yes, and it was to form this. And he said, I want you to have a leap of faith with me. We're going to try a lot, we're going to test a lot, we're going to fail a lot, which isn't a great way to sell someone, you're trying to get into their pocket. And we sat there, and it was all about opening up the innovation thinking atmosphere, environment. And here we are already less than 6 months in, and we have ideas percolating. And that's important to me, that people know you don't have to go to one place. You don't have to go to the Pittsburgh, the Washington, D.C.s, the Boston, Massachusetts for these ideas. We're doing it here in West Virginia, and we're going to change the stigma, and we're going to continue moving ourselves forward, create jobs, improve the patient experience and outcome, and keep driving ourselves forward.
Yeah, and I would add for Intermed Labs, specifically, for us to continue to expand the partnerships that we have with hospitals across Middle America, and have a bunch of businesses that are started through Intermed Labs partnerships. As David mentioned, we believe this can be a job engine as well, that can help grow our economies. But ultimately, we started this in some ways. Tom, Justin, and I got together really through COVID. We sat down and said, hey, what are we going to do? We're here in West Virginia. If things go sideways, we better find a way to save ourselves. And so it started there, and hopefully one of our innovations will help.
Well, we'll talk about that first device, the vent splitter that came out of the most trying time, which is the pandemic, that we created here and shipped out to Hospital for Special Surgery in New York.
Yeah, that's really how this started. I mean, Tom and Justin had already been working on many devices in the past, but I called them, it was early March when you remember there was a lot of talk about, ventilator shortages, and it was kind of scary there for a little while, I think it's safe to say. And I said, what are you guys doing? And no surprise, both of them had already been starting to work on a ventilator splitter. And so I said, let's jump in and work together. We ended up scaling up what they were doing instead of just providing some ventilator splitters that they were working with Dr. Paul Guerra at Mon Health with. We decided to scale that up and started to send out ventilator splitters to different hospitals around the country.
Yeah. So let me jump in. The ventilator splitter was a device that was created with Dr. Garrett, an anesthesiologist that manages airway and vent, and it doubled capacity of a ventilator to be able to take one ventilator and add it to two, sometimes three, to be able to take the one device where we sparingly had enough or thought we had enough to double, triple capacity for people who would need it. And that came from here. And relationships with an anesthesiologist at the Hospital for Special Surgery led us to take it up there where they used it in New York. We never, thankfully, had to get to that level here, but we had it if we needed to. That's the exciting part about the innovation. It's the idea. We have a hospital, we have an MRI, we have a CT, we have anesthesia machines, we have doctors, engineers, that we could bring them together in a non-competitive environment to create a device and hopefully help the patient outcome, but also might have a way to commercialize.
Wow, you guys, both of you, this is so fabulous. To hear and have it right in Morgantown it's amazing to have these kind of services right in front of us. Even I'm in Uniontown, PA, just to know the 30 minutes away, or in Hopwood, PA, which is 5 minutes from me, to know that we can come to Mon Health for all this full service. And
not to put a shameless plug, but we have a physician practice, a gynecology practice in Hopwood. So if you ever need help, I know a guy and a gal.
Thank you. That's great for all of us to know. And I'm going to try and switch over to a couple questions. If you all have a couple more minutes, I'm trying to keep this to 12 o'clock, 12:05, because I know everybody's busy. There's one in the chat already from Tanya, my coworker, who is she's the head of community and partnerships for Vantage Ventures, and I'm sure you'll probably hear from her. She's asking, how do you feel the hospitals can get into underserved communities more to create challenge and less fear of healthcare and doctors? And she says, I know GW had a Mammovium offering free mammograms to persons regardless of their ability to pay or not.
Well, we see that in West Virginia today. You have Bonnie's Bus through WVU. You have family planning vehicles that come in to provide family planning or gynecological access to people in underserved markets. The first foremost I think you have to start with is, why don't people potentially own their healthcare more? They're scared. They're scared of getting sick. They're scared that the sickness will cost them excess money out of their pockets, the pressure and what that means to them, but what it means to their families. So the first is, you got to own your healthcare. The second is, the doctor or the nurse practitioner or the physician's assistant or the psychologist, they're there to help you. They're not, we can't fix you if you won't allow yourself to be fixed too. So you got to own part of it. And then the other is, telemedicine, I think, went a long way to open up access during the pandemic. When we have surgeons who could do a surgical consult with a patient over video, that goes a long way. When you have psychiatrists who can practice behavioral health medicine through virtual, one, to take the stigma away, because some people don't want to be seen going into a particular doctor. Someone from the grocery store will see me walk into X, Y, or Z office. Well, now you could do it by virtual. Then no one knows but you. So I think that's a part of it. The other is, and unfortunately, this is the bad part of the story, West Virginia, if we did not have the states like Alabama, Arkansas, and Mississippi, we're the bottom of the barrel in most healthcare outcomes around the country. We're morbid obesity, high cancer rates, high heart disease. We're losing population. We're about 1.7, 1.75 million people, most of which are on governmental insurance, whether it be Medicaid, Medicare, or PEIA, all of which pay less than cost to healthcare systems. And I have a pledge from Mon, we will not bankrupt the patient that needs care. So people are scared financially, and we have a lot of socioeconomic headwinds. Now, that being said, we got some of the best healthcare in the state. So you got to take the leap of faith to connect with your healthcare provider, get your blood test, get your sugar tested, get your mammograms, get your screening colonoscopies. While you don't want to get the bad news on the front end, it's a heck of a lot better to have a potentially malignant polyp on the screening that could be caught on the front end than it goes into cancer later. And we're seeing that post the pandemic. People put off care way too long. I could tell you today, the acuity of the patients coming into our hospitals regionally and nationally is significantly higher than pre-pandemic because they were doing their screenings. And I'm worried the 6 to 8 to 9 months people were at home who were ignoring it or didn't have access are sicker today, including the anxiety and depression and behavioral health impacts that are coming post that we have to be prepared for.
It's so true, all of that. That includes me too. I was nervous to go get testing because of COVID being out there. You don't want to go into the hospital. So
Right.
I totally can relate to that. And you just wonder in the underserved areas where they don't even go in, they're probably even more resistant if they didn't get the COVID shot and they don't
Yep.
want to be.
And that's why my model, and many, is to push care into the communities. We bring doctors through offices, through existing hospitals into their offices. We're in St. George, we're up in Garrett County, bringing them through already established providers. And then we have the access there and they pick up the phone. We instituted a system-wide referral line. So if you're coming from Thomas and Charleston or Welch or Garrett or even Pennsylvania hospitals that don't have capacity, they call one line, MonCall, and we can get them into a doctor's office or we could get them into the hospital. I mean, my phone's been ringing. I have 3 people calling me that I'm working through right now just to get them into a doctor because they've let their healthcare go too long. That's our job in healthcare, is to make it easy.
I couldn't agree with you more. We have another question that popped in. This one's for Ashok from Sarah Biller, our executive director. Can you share areas of innovation that you see Intermed Lab is really excited about right now? Anything you're working on?
Sure, Sarah. Yeah, I think, with Intermed Labs specifically, we're somewhat unique because we work with both hardware and software solutions. So when you look at med tech, a lot of those investments have been going into digital solutions, AI and whatnot. We work with those technologies, but uniquely, we also combine those with hardware solutions, which I think makes our services unique, and it's something that's pretty exciting for us. Interestingly, though, when I look at the areas of innovation, what we're always surprised by is that really it's the simple devices that people think, oh, there must be a solution for this or whatnot, and encouraging Middle America to just take some of those simple ideas and turn them into a reality, I think is the most exciting part for us, and it's going to allow innovation to really blossom when a lot more people are coming up with ideas. One of our ideas is Snaps that you'll find on our website. Very simple eye shield solution. There's very little technology involved in it, but it's a great invention that's going to help the quality of care and probably become the standard of quality of care.
Fantastic. Here's another one for you, Ashok, from Hamid. I know researchers in our region are usually concerned about costs associated with prototype development, market analysis, and strategic guidance. What do your costs look like for your services? Understanding that this may be a variable depending on the complexity of the projects. You bill hourly, have a flat structure. Are you graded? What's, help from the FDA?
Right. We have different models that we work with different institutions, but typically what we'll do is we'll work with institutions to identify an investment that they're willing to make or interested in making in med tech innovation, and from there we essentially use that time to evaluate ideas, inspire staff to come up with ideas, evaluate those ideas, and then start to prototype those ideas. It really is dependent upon the ideas themselves as to how complex they are and how long they'll take and whatnot. And in some cases, institutions may decide to make an initial investment in bringing some ideas to market and then decide that they have something that they're really excited about and may need to may be interested in kind of expanding a bit further. But in addition to working with those hospitals on that sort of a basis, we do from time to time also work on a fee-for-service model with specific projects. But our target is really to work with institutions overall that are looking to advance medtech innovation.
Yeah, and the other thing to add, in the environment, we are prohibited in a healthcare organization when you're doing research on a device or a clinical trial, what's billed versus not billed to a patient, and we abide by all of that. Our model also allows for the inventor of an idea or inventors of an idea, they own a piece of equity through it as it moves through the ecosystem. So what we want to do is make sure the creator gets the financial upside of an idea. If it gets to market or it gets bought or something, we're a facilitator, but we want to make sure many people create an idea, and depending where they work or their structure and ability, they may not get the financial wherewithal of their idea. We're creating an atmosphere where they can. And I think that's an important, it generates ideas. When people own a piece of something, they are more accountable than when they just bring the idea or work and collect a paycheck and may not own the outcome. And if they can get a reward for it, hopefully will spur on even more innovation.
It's so great. It's so great to have this. You guys are like this little pocket for us in West Virginia.
I say that about Mon Health all the time, and I bleed blue and gold. I joke all the time, blue and gold or blue and yellow makes green. I mean, at the end of the day, that is the Mon story. We're nestled in between the Pittsburgh and the WVU medicine systems, all fabulous. I know, have you heard a Mon General CEO say wonderful things about our competitor? Absolutely. I love the collaboration and the opportunity. But not everything is in the biggest places, and it can't all be done in the biggest places. Where you have more intimate touch, I think can really spark the opportunity to get into the weeds and the detail to drive change, and then partner with others that have more scale, resources, and infrastructure to make that change hardwired into reality.
Phenomenal, you both. We so appreciate you being here today. It's been such a wonderful conversation. This is one of my lean-in Zooms. Some of my colleagues not at WVU talk about events that we participate in, and the ones that we lean in, we feel like we want to hear more because we're leaning forward, and it's just such exciting and innovative news. And the patient care part's so important, especially since we have a lot of elderly. It really, to me, in our areas, that's what's great for me, the elderly patients that get this quality care, and it's not a big conglomerate hospital that they're having to go to. They can get in one of the areas of Preston or even here in Uniontown. So
our patients know our doctors, and our doctors are available at the bedside. That's where I think the secret sauce happened. I've worked for those big conglomerates, the for-profits, the large institutional organizations, and there's a place for all. We're blessed, as I've said, in North Central West Virginia, where you have your leading academic quaternary tertiary research, and you have your advanced community hospital. We can't function without each other. If we disappear tomorrow, Ruby can't absorb all that volume, or UHC, or even into the Washington Health System right north of us. So it's vital that we collaborate where it makes sense, continue to treat our patients with open, and then this Intermed Labs is helping us recruit new talent to the area that we wouldn't have been able to do on our own. We have an institutional research board here, so our IRB can approve these concepts where it needs to be tested. Dr. McClellan and Ashok and team have had access, third-party buying the time to our MRI to test devices and concepts. You could do that all right here, and they're right on our campus. So to me, it's the triple aim.
I agree. Thank you both so much for being here today, and for everybody that tuned in, we thank you too. And thank you all.
Everybody.